Welcome to the monthly issue of the Journal of Vascular Surgery, Venous and Lymphatic Diseases. We're highlighting several papers that we believe you will especially want to read, but we also encourage you to read the entire issue of the JVSVL. The editor's choice for this issue is a paper by Marsden and other investigators from a study group entitled Baseline Factors Affecting Closure of Venous Leg Ulcers. 3 separate but similar and nearly identical randomized trials investigated a novel topical cell therapy for venous leg ulcers. Although the cell therapy did not facilitate wound healing, the authors used the pooled data from the control arm of the study, which used standard compression therapy, to determine the factors in a venous leg ulcer that predicted wound healing. The study found that the size of the wound, the location of the wound on the leg, and the duration of the existence of the leg ulcer were all important predictors of wound healing when standard compression with a 4-layer dressing was used. In addition, women were more likely than men to heal their venous ulcers. These data help clinicians predict the time anticipated for venous leg ulcer healing and the characteristics of those healed ulcers. The next, one of the most challenging deep venous problems is chronic cerebrovascular venous insufficiency due to outflow obstruction. A study by authors from Italy, led by Giacchina and co-authors, and the United Kingdom, published their paper entitled Factors Influencing the Hemodynamic Response to Balloon Angioplasty in the Treatment of Outflow Anomalies of the Internal Jugular Veins. And they investigated the technical factors that affected the initial success and long-term patency of internal jugular balloon angioplasty. They performed nearly 800 procedures and studied the characteristics most associated with success. They found that younger patients with transverse venous defects and a high flow pre-dilatation were most likely to respond to balloon angioplasty, and that those were the ones that remained patent, while those with hypoplasia or very long defects were less likely to respond to PTA. The authors recommend using anatomic characteristics and patient's age when selecting patients for balloon angioplasty of the internal jugular vein, irrespective of the type of disease that's being managed. The next paper, which is the CME paper for this issue, is Contemporary Outcomes of Elective Iliocaval and Infrainguinal Venous Intervention for Post-Thrombotic Venous Occlusive Disease by Rollo and co-authors from UCLA. They reviewed their experience using an aggressive interventional approach for patients with chronic venous occlusions and treated 31 patients with endovascular approaches, including lysis, super and infrainguinal angioplasty and stenting, as well as removal of previously placed vena cava filters. They showed a high initial recanalization success, a significant improvement in the SEEP score post-procedure, and a patency of almost 70%, as well as an improvement in symptoms and swelling in most patients. Several stents were extended below the inguinal ligament with good patency. The authors recommended attempting to remove all vena cava filters to improve patency and extending the stent below the inguinal ligament when needed to treat all stenotic disease was the best method of obtaining optimal patency. The final paper highlighted today is Superimposition of Elastic and Non-Elastic Compression Bandages by Chassagne and co-authors from France. They investigated the pressure of superimposed bandages and compared them to the pressure applied by a single component bandage. 6 different bandages composed of 1 elastic bandage, 1 non-elastic bandage, or both were applied in a spiral pattern on both legs of 25 patients at risk of venous thrombosis. Pressure was measured on the leg in the supine, sitting, and standing positions. The two single bandages applied similar pressure in the supine position, but their superimposition showed different pressure levels with a similar static stiffness index depending on the order in which the bandages were applied to the leg. They concluded that the order of bandage application has a significant impact on the interface pressure, but there was a poor correlation between the pressure applied by each bandage component and the pressure resulting from their superimposition. These data should be useful to clinicians who use compression in all patients with venous ulcers, which is standard of care in most countries and in most institutions. We hope you enjoy these 4 papers and the other excellent papers in this issue of the JVSVL. Thank you.